we are going to go ahead and bring in our special guest. You've heard us talk about him several times doing our ad reads. I hope the good doctor appreciates our ad reads. We try to do it our best. He is Dr. Chad Denman. Dr. Denman, I know you obviously know Keenan Womack. I'll introduce myself, Eric Henry of 24/7 Sports, CBS Sports. A pleasure to meet you and appreciate you making a couple minutes to join us, sir.
Hey, thank you so much for having me on today. I really do appreciate it. One of the things that encouraged us to be on this channel was that we do end up seeing a lot of people that are heavily involved in sports. And so, if you look at the Dallas Cowboys, or you look at any NFL team, pretty much the whole front line has sleep apnea. They're all on a CPAP. They're all on an oral device. They're all pretty much in the severe category. And they can't lose the weight in order to get their sleep apnea under control. So, that's their job, is to be big and be bold. So that's something we can help a lot of athletes with, is recover faster, get their resting pulse rate down, help with their airway. So Keenan, thank you, Eric, too, to having me on. And if you guys have any follow questions or anything like that, I really would appreciate answering them for your guests.
Yeah, for sure, man.
Can I go for one quick question?
Yeah.
I'll turn the rest of it.
No, for sure.
Dr. Denman, I have been super curious about, sleep apnea and kind of what causes it. I have family members who have dealt with sleep apnea. And of course, the typical thing you hear is weight, right? But correct me if I'm wrong. There can be other factors, because I've known, smaller people of any gender who have struggled with sleep apnea. Can you just kind of provide, he's Keenan points himself, just kind of provide some information or clarity on that?
Yes, absolutely. So weight is one thing that we look at. Usually, the first sign and symptom is when patients or people breathe heavy at night. That heavy breathing turns into either snoring or snorts in the middle of the night. You might have woken yourself up a time or two. What that is that's the structures either in the back of your throat or in your mouth getting too close together. So your tongue and your soft palate, or the tongue in the back of your throat, vibrating together, causing snoring. Another sign and symptom that people kind of go without paying attention to is usually acid reflux, or getting up to use the bathroom in the middle of the night. Now, both of those responses are due to when your oxygen drops, your cortisol, your stress levels go up, and that causes more stomach acid. That also causes your bladder to kind of start tensing at night. And so it's really important that if you do wake up tired, or you reach a point in your day right after lunch, typically, or right after dinner, where you're feeling yourself very low energy, or you need a nap, to get in and get a test. Right now we're only identifying about 3% of the population that have this disease. And what we know as of this year, a third of the population above the age of 40 have sleep apnea and do not know it. So ultimately, that's why I want to be on as many of these podcasts and on news channels as we can get on, only because it's going to surpass blood pressure this year. So for the first time in America, and weight has a reason for that, but it's not all the be all and end all. Actually, my worst sleep apnea patient was 86-pound female. Now, people can also have developmental issues that lead to this, that have been overlooked their whole life. And so talking about being able to keep your oxygen up and your pulse rate down, let's just say it real simply. Oxygen is life. And if you can breathe normally and naturally, that's usually the best treatment for patients.
Chad, you are a Florida man, as is Eric. Where did you play? What sport did you play? And where did you play?
Florida State University baseball.
So I thought that was pretty cool. So Eric is from the Tampa area, correct, Eric?
That is correct. Born and raised in Tampa, was raised a Seminole fan, but went to UCF. That is correct.
Oh, that's awesome. I actually also grew up in the Tampa Bay area, and a little town called Zephyr Hills, and then ended up going to Florida State for undergrad. So. And I was telling Keenan I was a walk-on, so I didn't.
Still got the ring.
Yeah, got the ring. Everything worked out great for me.
Played for the great Mike Martin, I'm assuming.
Yes, and I was a catcher. That's the position that I played.
There you go. There you go.
Last thing, but I was just curious how you think some of these like sleep apnea things affect athletes, because I feel like that would be a major deterrent for certain athletes to be able to play at their best. Like for me, my focus was a big problem. Was like I couldn't focus because I was so tired all the time. And like, how often is it that you see like great improvement from people who are athletic in their lives due to this kind of treatment?
Yeah, we see patients on a weekly basis that once we treat the sleep apnea, they thought it was just part of them aging. Some people start experiencing, not being able to sleep well or lack of oxygen, whatever that might look like, as poor recovery, where they used to be able to recover from a workout or an injury in a certain period of time, and now it takes longer. Unless you're in your 70s or 80s towards the end of your life, you really should be able to recover well. And if you're not, usually there's signs and symptoms for that. The body's not working at its peak efficiency. And Keenan, I know you know this, but for the rest of you listeners out there, viewers, we all sleep for a reason. And we don't sleep just to lay there or to rest. Actually, the whole body's systems have a schedule that they need to keep. And that's why we breathe so heavily at night. We want to keep that oxygen at 98, 99% all night long so that the body's systems can turn over, whether that's your red blood cells, your muscle, your bone, whatever structures we're talking about that needs to be repaired and turned over. And especially when it comes to sports and you're trying to push that athlete as much as they can, recovery and getting the oxygen and the sleep that you need is very important.
Yeah, man, it's pretty crazy, and he is my doctor, of course, and that's how this whole thing started. Was I went to Dr. Chad? I guess that was probably like 8 months ago, something like that,
Yes.
7-8 months ago, and did a test, and I was just always tired. I was falling asleep at work. It was a problem at work. It was always a problem in school. I would just fall asleep at my desk like constantly. And, I don't have to have a CPAP. Like I have a different device that works for me. That's fixing it gradually. That gives me sleep at night. And it's been life-changing. So any of our listeners, man, like if you're an athlete and you're somebody that likes to go out and run and things like that, like part of my nostril is underdeveloped and that's being rectified. I can breathe better even when I'm not sleeping now. So these things affect every part of your life. So definitely, man, if you're struggling with this at all, I can't recommend it more than to go to Dr. Denman, because this dude truly like impacted my life in a really positive way. And my life is so much better for it now. So I have you to thank for that, man, for real. And we really appreciate you coming on the show and spreading the message, my friend.
Thanks, Keenan. And I don't know if your viewers have seen the changeover, but you don't have the black circles underneath your eyes anymore, and you're just a lot more.
I feel so much better. I lost weight too, and I like not even like changing anything else. I was just like sleeping better. I have more energy. I can do things. I wake up on time. I'm not late to work. Like it's just a physical change that's been crazy. So thank you so much, man, for coming on. We really appreciate it, Doc.
Thanks so much for having me.
Real quick. Yes. Dr. Denman, can I sneak one more question in, or you got to?
Absolutely, yeah.
All right, I'm gonna sneak one final question here because you guys both kind of talked about it, and I'm just curious from my perspective as someone doing this job, reporting. Sleep schedule definitely non-existent for me. When you're covering late night games and trying to develop any sort of consistency. What advice? Because listen, I'm gonna have to come through Sleep Cycle Center, not just because you are a sponsor of the show, but I, got some of these dark circles going on right here because sleep isn't constant for me. And I will admit, and you probably are gonna face palm, Dr. Denman, but I've gone to the melatonins and things that world to try to get sleep, and it's not exactly the best. So I'm just curious, what advice would you give for someone like me who works a job and you're on planes, you're trying to sneak a nap in between covering games, this, that, and the other, and you can't really develop a consistent sleep schedule?
Yeah, and you touch on a very difficult concept, especially in America, because a lot of people do work shift work, whether it's at night or then they switch back to the day, and it's inconsistent. If I can, wave my magic wand over the age of 40 for all of our listeners out there. Your bedtime should be the same every night. So, Eric, when I'm talking to you directly here, if you do have late nights and you are needing, to stay up late, being on that schedule consistently 7 days a week would be my advice on that. Now, I know you also have this commitment, so that might be difficult to really work through. But ultimately, in our 20s and our early 30s, we probably can do just about anything that we want to. But as you get older, it gets more and more difficult. And the biggest sign of that is when you travel overseas or you go to a different time zone.
Yeah, jet lag.
Jet lag. When you're in your 20s and you landed, it probably wasn't a big deal. And then, as you get older, that recovery is just more and more difficult. And the reason for that is your body, when you're in your teens and 20s, is at its peak efficiency, so it recovers faster. And so if you combine that with limited airway or sleep apnea or whatever the case may be, it starts chipping away at that. And it just takes you longer and longer to rebound from that.
There you have it. I will have to, as I said, Keenan has introduced not just me, but our Texas Sports Unfiltered audience to Sleep Cycle Center and the great Dr. Chad Denman. So I'll have to go check him out. And, he's a Zephyr Hills guy. I'm from Temple Terrace. So I grew up about 30 minutes down the road from him. So I got to check out my guy. Dr. Denman, cannot thank you enough for making a couple minutes to join the show, and enjoy the rest of your day. And again, we will make sure to keep plugging Sleep Cycle Center because sleep is important.
It is.
I really
Thanks
appreciate
so much, Doc. Appreciate you, man. I'll see you soon.
See you soon. Bye.